Hi, friends. It's Beth here with Aging Care Solutions. Welcome back. Happy to have you. As you know, I offer both professional and personal experience and guidance for aging seniors, caregivers, adult children who are helping their parents navigate and travel the care journey. So, again, welcome. I'm excited to have you here. This topic, and it seems that I'm going into more and more difficult or challenging topics, but this is part of life. It's part of aging. And I've lost a lot of people in my family, so many. I've lost a brother, I've lost a mother, a father. So, and many clients over the years, and doing this for more than 20 years, I've gone to a lot of funerals. And so to me, it's like life is such a gift, and I just feel like we need to honor ourselves and our loved ones for as long as we possibly can. And one of those services that we can honor them with is palliative or hospice support. I cannot tell you how over the years I'm trying to stop the glare on my glasses. I need to get a specific type of light, and I haven't done so yet, so I do apologize. But one of the things that I noted, and I was mainly in the home health division and or private duty nursing division, but working closely with our hospice team coordinators, a lot of times families wait till far too long to call for an assessment. I know that people do not like to hear the word hospice. They already know. They feel like that's it, like that we have given up. But that couldn't be further from the truth. In fact, I talked to a hospice nurse yesterday, and she said, over the years, we've discharged many people who their treatment started to work, or their body started to heal whatever infections were going on, and they were discharged off hospice. So just because someone doesn't want it doesn't mean that they don't need it. And I think for families, what you want to look at, and when you do your research and you speak to the various experts that you'll come in contact with when you're caring for your loved one, many times it's when a doctor has determined that someone has a terminal illness with a life expectancy of 6 months or less. Now, the difference between hospice and palliative is that palliative care is really like pain management. So if you are still undergoing treatments for a diagnosis like cancer, if you have end stage COPD, or you have a congestive heart failure, some of these conditions, you're up and down with your health. And so a lot of times, even though they may theorize that you have a certain amount of time to live, a lot of times you're still seeking treatment, or you're still taking, whatever medications you are still doing, and trying to maybe even work with, a physical therapy team to continue with your strength, and still seeking treatment, getting your chemotherapy. So that is when palliative support would come into play. Now, not all home health agencies or hospice agencies offer palliative because they don't have the staff. I mean, there's other reasons, I'm sure, but many times, I know the hospital system that I worked at did offer it, but we were one of the few that would offer it. But many times when someone is seeking palliative, it isn't all that long afterwards that they really do qualify. They really could have had the additional layer of support coming in the whole time: the nursing visits, the pastoral care, the home health services, the home health aides coming in with personal care, able to bathe and assist with personal care and hygiene. I'm trying to think of the other. Oh, social work component. So those are some of the things that palliative will provide. And of course, those are the same things that will carry over into hospice as well. So the key factors that are going to indicate the need for hospice is going to be if a terminal illness diagnosis and prognosis are delivered by a doctor through an assessment, where the patient does have a terminal illness of 6 months or less, given whatever indicators are showing and presented to that physician. If there's declining functionality, difficulty performing their activities of daily living, you've heard that term ADL, like bathing, dressing, feeding themselves, transferring and ambulating. Those are all indications. If someone is unable to do that, or their symptoms are unmanaged, they're unable to manage their symptoms, getting a progressively worsening pain, nausea, vomiting, shortness of breath, other difficulties that are not adequately controlled with standard treatment, that would warrant a hospice assessment. If someone has frequent hospitalizations or frequent emergency room visits, that's another indicator that someone maybe could benefit from a hospice assessment and getting hospice services set up for them. And of course, if their health is really declining, maybe their mental health, their physical health, if they're sleeping more, if they're not taking anything by mouth, so their decreased appetite, weight loss is noticeable, significant sign of loss of appetite, weight loss, if they're beginning to shut down and their symptoms are just, they have not improved or the quality of their life has not improved. And you'll notice if someone is sleeping more and if they just can't get out of bed, decreased alertness, and changes in behavior, noticeable behavior changes like withdrawal, increased irritability, confusion, or if their pain is unmanaged or uncontrolled. So this is when I would really encourage, even if that person, when you are speaking with them, said, no, just tell them I have a nurse coming to assess you. I mean, just remove that word altogether if that's going to make the whole process go better for them. Because in the end, to get compassionate care and have people come into the home or come into the assisted living or come into the facility where your parent is living, to me, I waited too long. I knew that my mother did not look well the Tuesday before I saw her, and I said to the social worker, she needs to be assessed by hospice immediately. I want to have somebody come out. She goes, well, let's just wait. Next week is your care plan meeting. And 2 days later, my mother was dead. And I agonized over that for some days afterwards. But, my mother went out the way she wanted to. They said she had a really wonderful day. When I saw her, I thought today could be her last day. But the next day she rallied. She was walking. She was doing things she hadn't done in weeks. And so that was her farewell, I guess. She died the day before my birthday. And I was relieved for her because her body and her mind had stopped working almost a decade or more than a decade before that. So I encourage you, follow your gut instinct. If you know your parent and you know that they are declining and that you feel like I need support, I need the people that come in that can help me see when to manage their medications, if they need morphine or anything like that. I need guidance with this. These hospice agencies are angels. They are going to come in and they are going to be one of your best resources. So I encourage you not to wait too long. Many times people, they call the ambulance, they put them in the hospital, then they come home. They put them in. If they want to stay home, bring the care into the home. That's the best advice that I can give on this topic. If you have any questions or concerns or anything that you think might be helpful, I'm happy to do another video about this as we all start to realize what can we do for each other, how can we help each other, and this is a big topic. So I hope that you glean some information from it. Feel free to comment, and if you could please subscribe, I'd truly be grateful, and I wish you all the best on your healthcare and caregiver journey. Thank you. See you at the next video.